wet macular degeneration is a common condition, and it used to be the most common cause of legal blindness in our community. But now we've been really lucky that we're in an era where there's a really effective treatment which slows down the progression, and in 9 out of 10 people get an improvement in their acuity. And this is the injection treatment, which people find horrific, but really the thought of it is much, much worse than the reality. The reality is actually very mild. But before we get to the treatment, let me go through with you what wet macular degeneration is. Wet macular degeneration is the growth of a new blood vessel up through into the retina where it's not meant to be. People have the preceding factor before you have wet macular degeneration is that you have dry macular degeneration. And dry macular degeneration has these drusen, and these drusen are weak points where the new blood vessel can grow into the retina. This new abnormal blood vessel bleeds and it leaks, and it forms scar tissue, and this combination of bleeding and leaking distorts the anatomy of the eye and the macula, so that people's vision deteriorates worse and worse. We are in a fantastic situation now, however, where this new injection treatment, as I said, halts the growth of that new blood vessel, and it can actually reverse it to a very large degree as well. So on average, people get 2 lines of visual improvement when you start the treatment. So the relevance of this is I would recommend everybody come in early. If you come in when you can only see the A on the top of the chart, you'll only get 2 lines of improvement from there. 2 lines on a vision chart. If you can read, 2/3 of the way down a vision chart already, 2 lines of extra vision there will put you almost back to completely normal vision. And quite a number of patients have normal vision following the injection treatment. So what if you don't choose to have the injection treatment? Well, the scar and the bleeding and the leaking and the new blood vessel gets larger and larger, and you sometimes over a few weeks, but often over many months, and by the time 2 years comes around, about 70 to 80% of people have legal blindness in that eye. That means you don't lose all vision, so it's not completely black. You only lose the central vision, the area of the retina called the macula, which is the central part of the retina. Your peripheral vision is maintained because macular degeneration doesn't extend that far. The new blood vessel doesn't grow that far out. So you'll always have peripheral vision, but you lose reading, you lose driving vision, recognizing faces, watching TV are all problems. So the treatment is injection treatment, and I will go through that in a lot of detail in a separate video. But the injection treatment is really straightforward. Patients can't see it, they can't feel it, and it's incredibly safe and incredibly effective. And our staff will lead you through it. I hope that gives you an understanding of. Oh, there's one more point, by the way, I want to tell you about wet macular degeneration. The other thing is that wet macular degeneration is, or macular degeneration is a bilateral condition, and what can happen in one eye will often happen in the other. Years. There might be years apart, but it's worth being. Even though you say, "Oh, look, one eye may be affected," you should get active treatment as quickly as you can, because it may be that 1 or 2 or 3 or 5 years later, the other eye can be affected, and you never know what the vision's going to end up with that one. So, the take-home messages in a separate video. I've talked about dry macular degeneration. Take all the vitamins and other things to prevent the macular degeneration deteriorating. If you notice a deterioration of vision, come in as quickly as you can, and don't be scared of the injections. They're really straightforward and they have amazingly good results. Hope that gives you some information on wet macular degeneration.